Now do it. Hi, Bio245. This is Vanessa, and I'm here with respiratory stuff today. Also with some repro stuff in another video, but for this video, we're going to stick with respiratory. And we're going to be doing upper and lower, starting off with upper. And in addition to this, we'll be doing a little bit of definitional stuff as well. So just going down the list, as we normally do. We have pulmonary ventilation as first and foremost, number one on the list. Pulmonary ventilation is just the act of moving air in and out of the lungs. So that's pulmonary ventilation. Versus respiration. And you can see on your list the next terms are alveolar gas exchange and systemic gas exchange. So it says external respiration, internal respiration, and I think on your guys' lecture that you're going to have, it says external and internal respiration as well, but in your book it defines them as alveolar gas exchange and systemic gas exchange. So do with that what you want to do. You can choose the regular terms or the parentheses terms. But either way, alveolar gas exchange or external gas exchange is gas exchange that occurs at the finer levels inside of the lung. And we're going to talk a little bit about the finer structures. We don't have a good model for the finer structures, so don't worry too much about being able to identify that on a model. Just know some of the definitions of these. But alveolar gas exchange or external respiration, again, is where we have oxygen being inhaled into the lungs, and then of course those capillary beds are surrounding the alveoli, which are small structures inside of the lungs that have that simple squamous epithelia to allow gas exchange from the lungs, the air in the lungs, to the capillary beds that surround them. So that's that alveolar gas exchange where we're inhaling oxygenated air and that oxygen is diffusing into the bloodstream, or vice versa. We have CO2 in the blood, right, because we've had that blood go through the tissues and pick up CO2 because that's a byproduct of respiration, right? So it has that CO2, and that CO2 is released into the lungs, and then we exhale that CO2. So all of that is part of that external respiration or that alveolar gas exchange. After that, we have systemic gas exchange, and it's basically the other way around, right? So that's internal respiration. That's going to be the capillary beds at the tissue level. So rather than having blood interacting with air inside of the alveoli, it's blood interacting directly with the tissues, like your muscles, for example. If your muscles are working hard, they're using oxygen, and they're also producing CO2. So gas exchange occurs at that level, and that's going to be that internal respiration. So inside, sealed away, versus external, where we're interacting with the external air. Okay. All right, so that's it for that definitional stuff. Let's look at some of these structures. So first off, we have nostrils or external nares. External nares is something you might see more commonly if you're looking at anatomical terms, but nostrils is the term from your book. But whichever you prefer, stick with it, right? That's all we care about for your practical, is that you're consistent and you know how to spell it. So for nostrils, everybody knows, but here we go on our model. Next we have the conchas, which we've learned before, but we'll just do it real quick anyway. So we have the superior, inferior, and middle nasal concha. So here's our nasal concha, these lumps inside of the nasal cavity here. So superior, middle, and inferior nasal concha. Next we have the sinuses, but we've done the sinuses to death, so we're going to skip those for this video. Next are the palates. So the palates are going to be the roof of your mouth, and there's a hard portion that's the roof of your mouth, and then there's a softer portion kind of towards the back. And if you feel along with your tongue, you'll see that too, that there's a bony roof of your mouth, and as you move your tongue further back, just before you get to the uvula, right, with that little dangly guy at the back of your throat, it's much softer. There's not really bone there. And you can see that reflected on this model. So here we have the bony portion of the roof of the mouth, so that's going to be the hard palate. So hard palate's there. Then just behind it, we have the soft palate, and you can see that the bone stops right about here. If you guys recall, that's going to be your palatine bone, right? That's the back of your hard palate. And just behind that palatine bone is going to be the soft palate. Hanging down from the soft palate here at the very end, that's going to be the uvula. So that's that little punching bag that hangs down at the back of the throat. Moving on, we've got our pharynxes. So if you're like me, you're going to get confused in your life, because not only do we have this structure down here called the larynx, but we have this area here called the pharynx. So I don't have any like fancy ways to help you remember which one is which, but the larynx ultimately does go down to the lungs. It's more a part of the respiratory stuff. It has cartilage and stuff associated with it, so maybe that'll help you. The pharynx, however, is basically a funnel. Pharynx funnel. And the pharynx is this whole area here where we're conducting air from the nose and from the mouth and bringing it down into the larynx, okay? So first off, right here we have the nasal cavity. So right behind the nasal cavity, this little space that kind of leads down into eventually the esophagus and the larynx. This space back here is going to be the nasopharynx. So nasal cavity, this is the pharynx, so this is the nasopharynx. Pretty easy. Then you got the oral cavity right here, right? Because here's the tongue, we talked about that last time, and the space around the tongue and the mouth, so that's going to be the oral cavity. So just behind the oral cavity, again in the pharynx, that funnel that leads down, that's going to be the oropharynx. And lastly, we have the last part of the pharynx here, the part of the pharynx that leads ultimately to the larynx, and that is going to be the laryngopharynx. So the cool thing is as long as you remember pharynx and you remember the name of the cavities essentially, you know the name of the portion of the pharynx. It all corresponds, okay? All right. Next is on your list is larynx, which we talked about, but larynx, not only can you see it from the side view here, we also have a large model as well that you can check out three-dimensionally. So here is our larynx that you can see from the front, and we have a couple different structures here we got to worry about, and I'm going to actually show you on both models. So this is like basically if you turned this structure like this and then cut it in half and looked on the inside. Hopefully that kind of makes sense. So, oops, backwards on the video. So you can see that half of that blue cartilage there, kind of where your Adam's apple is supposed to be. Thank you. And same as this. Okay. So first off, we have the epiglottis. So the epiglottis can be seen in a couple different ways. Actually, I need another pharynx or larynx as well. We don't have it. It's okay. So, oh yes, we do. Excellent. Okay. So the epiglottis can be seen in a couple different ways. And what the epiglottis is this cartilaginous flap. Maybe you guys remember this, but it's elastic cartilage that's going to be kind of moving around and can cover up your larynx whenever you're drinking water. Because if you're drinking water, you don't want to inhale water. That's a sad day. It makes you not feel so good. So first off, looking at it from the side view here, again, here's our larynx that I've been indicating most of the time right now. But the epiglottis is this blue flap right here. So blue almost always means cartilage. So you can even see in here in the vertebrae, between the vertebrae, we have that cartilaginous disc. We have on the front of the larynx here that blue cartilage. So this blue flap right here, that's going to be the epiglottis that will cover the whole of your larynx to prevent fluid from going down. For the epiglottis on this model, it's this cool thing here. So you can imagine that this model is all the cartilage and stuff with the soft flesh stripped away. So normally there's soft flesh that surrounds the epiglottis, the cartilaginous part of the epiglottis, but in this case that soft flesh has been moved away. So this flappy right here that goes bloop and like covers the hole eventually that goes to the trachea, which we'll talk about. This here is your epiglottis on this model, so this flingy part. Lastly, you can see the epiglottis on a put together trachea, a larynx. So you can see that you can take it apart and look at the half view just like in the half head. So you can see it's the same, okay? And I'll show it to you also, but you can see the epiglottis on here as this kind of cup shape here. And you can see actually the hyoid bone. So there's our friend the hyoid bone. You might remember him from when we did the skeleton. And just behind the hyoid bone, you can see that there's this little lip kind of sticking up. And if you turn it around, you can see it's this kind of cup shape. And it's all this really soft flesh with the cartilage inside, so it goes bloop and covers the hole. So that's your epiglottis. Moving on, we've got the cartilages. So you have a thyroid cartilage and you have a cricoid cartilage. It's easy to see on this model just because it's really large, but you can see it on all the models. The thyroid cartilage is going to be this large kind of triangular portion. It's not like a perfect triangle, but to me it looks triangular in nature, so I always think it's this. So this is going to be your thyroid cartilage. And then just beneath it, see how like, here's the trachea, that's your windpipe. And at the top of the trachea, you have this extra fat disc of cartilage. That extra fat disc, that's your cricoid cartilage. And I always think like creaky throat, and that's what helps me remember the word cricoid. But just to show you on here as well, here again is your thyroid cartilage. And if you look just beneath your thyroid cartilage, this fat disc of cartilage right here, that is going to be the cricoid cartilage. And you can see just beneath it are the thinner discs of cartilage for the trachea, which we'll talk about. And lastly, you can't see it on here because it chops it off prematurely, but you can see your thyroid cartilage from the side here, and you can see it just a little bit from the front, tucked away behind some of that muscle. Moving on, we have the vocal fold. Now the vocal folds are an internal structure. On this particular model, the large model, the vocal folds are represented by this felt. So there you go, that's your vocal folds in there. Otherwise, it's an internal structure on these other models. So you have to either take this larynx and, so you can see, larynx and pull it open, and then you can see the inside, and you can see that it looks exactly the same as our friend that is, our friend that is next to us, okay? So the vocal folds on these models are going to be this little ridge right here. That's your vocal folds, where I'm pointing with the pencil. And it's the same exact ordeal on here. So you can see there is your vocal folds on this particular model. Next we have the glottis. The glottis is the hole through which the vocal fold and it passes through the vocal folds. So the best way to see the glottis actually is to take our little larynx again, put it together, if I can, on video. Come on, bro. There we go. So put your larynx back together, and if you turn this and look down the throat, so you can, there you go. So you can actually see through. There you go. You can look and you can see the vocal folds sticking out, kind of on either side of the walls of the pharynx or the larynx here. So the hole that you're looking down, that is going to be your glottis. So the epiglottis covers essentially the glottis. Okay, the glottis is just the hole. Moving on, we got the trachea, and this is where we can start passing into the lower respiratory stuff, so I'm going to pull out some different models at this point. So the trachea is just the windpipe, again, that leads down to your lungs. So on this upper respiratory model, that is going to be the trachea there. And then we have a couple other nifty models to show you. Pull up this one, because I like this one. We have a couple other nifty models to show you. So on this model, this is basically like all the cartilaginous stuff with the soft lungs kind of stripped away. But this part right here is going to be your trachea, obviously. And, oh, actually you can't really see your trachea very well on this model, but I'm going to point it out anyway. So you can see at the very top of this model, this is just your lung model, right? So at the very top here, you can see the top of the trachea sticking out. And then here, you can see the bottom of the trachea sticking out. Okay, so you can see that on there as well. Moving on, we have the hilum or the hilum, however you want to say. But basically, it's the same deal as what we talked about with the kidney. Now, with the kidney, we had that renal hilum or the hilus or hilum, however you want to say. But that was just that gap, right, through which the artery, vein, and ureter pass through. So just that little gap in the kidney. And for the lungs, it's the same exact idea. You have to have a little bit of a hole through which the tubes of your windpipe can pass through, but also the arteries and veins, right? So if you kind of take your model and turn it, you can kind of see exactly that. See how there's all these big vessels and all these tubes and stuff, and they're kind of going through this little gap? That there is going to be the hilum, and you can see it's kind of outlined by this gray line. So that gray line outlines the hilum, or the hole. Okay. Next, we have the main bronchi and the lobar bronchi and the segmental bronchi. So you'll notice that next to it also says primary, secondary, and tertiary. So you might hear me slip more into that because that's a little more common. And I believe that's what it says in your lecture as well, as primary, secondary, and tertiary. Though if you look in your book, you'll see again that main, lobar, and segmental. And you'll see different terms as you look around the internet at different pictures too. But basically, what a bronchi is it's a splitting off of your trachea. So again, here's our trachea. So you can see that it splits, one to go to one lung, so on the right side, and one to go on the left side. Okay. So this guy here is going to be the right side. This is a main bronchi or a primary bronchi. Okay. So it's the first split off of your trachea. And here on the other side, same thing. It's the first split off the trachea, so it's a primary bronchi or a main bronchi. Moving on from there, we have the secondary bronchi or the lobar bronchi, I believe, unless I'm messing it up already. No, I'm not. Excellent. So then we have the lobar bronchi. Now, the cool thing is if you know anything about lungs, you'll know that one side has 3 lobes and one side has 2. So we don't want you to be able to identify like the bronchi that goes to the specific lobe, but on here it's the easiest to see. Here's our main bronchi. Here's our secondary bronchi / lobar bronchi. So it's the first split coming off of our main So again, here's our main, and this one's the easiest to see. There's our secondary, or our lobar. Okay. And lastly is our tertiary, or our segmental. And in this case, on this model, the cool thing is that each of these little colored knobbies, that represents a tertiary. So this is a tertiary, this is a tertiary, or a segmental. Here's a tertiary / segmental, etc. Okay. Looking on the lung model, it's a little bit different. Okay, I'll show you both. But so here again, you can see the trachea, and it splits to form the primary bronchi or that main bronchi, and then it splits once more to form our secondary or our lobar. So the right lung in this case has the 3 lobes. So you can see on here, there's 1, 2, 3 secondary or lobar bronchi. And the left lung only has 2 lobes, so you can see 1, 2 secondary or lobar bronchi. Oh, and by the way, the singular for bronchi is bronchus, and bronchi is plural. Okay. And here we might as well look at our other friend. Ugh. Sorry, it's a little loud, clanky. And you can see it basically looks exactly the same. So you can have your trachea, main bronchi, secondaries, etc. And one thing I do want to point out on this particular model is that you can actually see that the hilus is colored brown here. So there's that space there where the tubes are passing through, and you can see it's colored brown. So that's kind of nice. All right, moving on. I need the other lung model again. Sorry, guys. Used to working with a little more space, I guess. We had to film in a different room today, you might have noticed. So we're trying to make it work. Alright, so moving on here, you can notice that on your list we have superior, middle, and inferior lobe. And you might remember that just a couple seconds ago I was talking about the number of lobes for the right and left lung. So the number of lobes will obviously dictate what kind of names you can use for the lobes themselves. And what I mean by lobes is you can actually see on the front of this lung model that there's like these little lines here that are separating out chunks of the lung. So this is going to be a superior lobe, this is going to be your middle lobe, and this is going to be your inferior lobe down here. Okay, so again, the right side has 3 lobes, so you have your superior, middle, inferior. Now the left side, you'll notice there's kind of this groove in there, which we'll talk about, but there's only 2 lobes. So we have the superior lobe and the inferior lobe, and that's really that. Okay, so there is no middle lobe on the left side. Okay, and then next on your list is alveoli. So alveoli is a microscopic structure, so unfortunately we don't have a model for it. But you should know that basically as you go down on the inside of the lung, again, the alveoli is going to be a very small microscopic structure. It looks like a little sac or like a little balloon, and it's going to be lined by that simple squamous epithelia, and that is where that gas exchange is occurring. Okay, and that's going to be at the very terminal end of what's called a terminal bronchi. So you'd notice that all these bronchi, as they, oh, here's another really cool model. All these bronchi, as they go down, they branch and branch and branch, and they get smaller and smaller and smaller and smaller, even up to this small little pokey guy right here. And that keeps happening for a really long time until it gets to its super tiny tube and terminates into an alveoli. Okay, next on your list is cardiac notch. So remember I was talking about this little groove right here. So this groove actually accommodates your heart, because remember your heart kind of leans to the side, right? This isn't the correct heart for this, but that's okay. So anyway, your heart kind of leans to the left, as most people know. If you're listening to the heart, you listen to the left, right? So here you can see I fit your heart in, and here's that cardiac notch right there kind of forming around it. So your left lung is about 10% smaller than the right lung. So, and that's also one of the reasons I think, or at least I always throw out there as a way to remember that there's only 2 lobes on the left and 3 on the right, because your left lung is smaller because the heart's leaning over to the side. Okay, just 2 more terms and then we're done with this part of the video. So we have diaphragm, which is going to be the muscular sheet underneath your lungs, and you're going to learn more about this in lecture and the purpose that it serves. But you guys know that if you get hiccups, you kind of can't control the influx of air, so you go so that air comes in uncontrollably, and that's actually a spasm of your diaphragm. So your diaphragm pulls down and creates negative pressure on the lungs, and then that causes you to inhale air. Lastly are the pleural cavities. Now I don't have a model of that for you today, but you should recall when we covered cavities, that the pleural cavities are just that membrane-bound area that surrounds the lungs. And you're going to learn in lecture that they are negatively pressured to keep the lungs inflated, otherwise they can collapse on themselves, and that's very sad. Alright, so I do have a shorter video coming up right after this, and so I guess I'll see you in just a little bit.